Recording in progress.
Yeah. Okay na po, kita na po.
Okay.
Sir, nag-e-echo po. Yung mic ko
Ah,
sa ano.
hindi.
ah, yung hindi, yung sa mic sa ano nyo po, sir. Nag-e-echo po yung boses ko sa mic nyo po.
Ah, teka, i-off kayo sa akin.
Thank you po. Okay na po.
Okay.
Kami po ang group 7 po, kami po ni JUS. Ang report po namin ni about sa fire-related death. So first of all, what is a burn? A burn is an injury to the skin or other organic tissue primarily caused by heat or due to radiation, radioactivity, electricity, or friction or contact with chemicals. And thermal heat or burn occurs when some or all the cells in the skin or other tissues are destroyed by hot liquids. So what are the types of fire deaths? There are accidental, which is from primarily po ang madalas po na ano niya is from children, elderly, or yung mga paglasing po tayo or alcohol related at sa smokers po. And then there are those suicides, which is uncommon at mas common po to sa Asian females po. Yung nagsusunog po ng parang pinapalabas po nila na arson pero hindi naman po. Ang at meron po sa crime which is yun naman po yung arson, concealment of homicide, and insurance fraud. So, what is the aim of autopsy for fire-related deaths? It is to establish positive identity. So, was the deceased alive during or at the time of the fire? Its cause of death or any contributory factors, example is natural disease, alcohol, or drugs, that is preventing from escape and preventing escape and the time of death. So, sa identification po, yun is yung visuals, including scars, tattoo, and etc. Circumstantial, it's yung ano naman po, sa jewelry, documents, spectacles, dentures, at yung sa radiograph po, which is the cranial sinuses, bony abnormalities in surgical implants, dental detail. Ito naman po yung ways of ano po para po ma-identify natin yung mga burn victim po. Ito po yung mga several ways po to identify them. Causes of death for fire-related victims. It is neurogenic shock, which is po yung nagiging ano po natin na para po nagko-convulsion po tayo due to pain. Thermal injury, which is hypovolemia, shock, acute renal failure. May mga example po ako mamaya sa dulo ng mga types po ng mga hypovolemia. Inhalation of smoke and fire gases. Most common is asphyxia. Ito naman po yung pag nakulong po tayo dun sa mga parang burning building po. Ito po yung mga most common ways na namamatay po. Hindi po talaga dahil sa nasusunog po sila. Ito po yung dahil sa nakakalangha po sila ng usok. And yung delayed death po. Ito naman po yung parang hindi po agad na treat yung mga burn ng patient po. Ito po sa inhalation of smokes and fire gases naman po, ito po yung nagiging process niya is wala. Thermal injury to airway, which is laryngeal edema or bronchospasm. Carbon monoxide, which is 200 times affinity for cyanide. Acrylide, which is found in wood and petroleum products. Hydrochlorics, na madalas po nakikita natin sa plastics and furnishings. Tsaka toluene deseasonate, which is from polyurethane pa. And nitrogen dioxide, which is po yun sa ano po natin sa automobile at sa aircon, yun pag sa kotse po natin nananatili po tayo nasa loob tapos doon po tayo natutulog tapos na ano po natin na sarado yung bintana at bukas yung aircon, dito po tayo nasusuffocate. Tsaka sa agricultural po yung mga pesticide products. Types of burns. There is ano po yung flame burns, which includes flash burns, contact burns. Ito naman po yung sa pagdaan napaso po tayo ng tambucho or ng mainit po na plancha, yung para po nagpepeklat na sugat. Radiant burns, yun po yung sa ano naman po sa sa radiation po. Scalding burns, microwave burns, and chemical burns. Generally alkaline, more severe than acid. Mamaya ka po papakita yung mga example po. Emergent care. Ito po naman yung mga dapat po natin gawin in case po na magkaroon po tayo ng burn sa ating katawan po. Burning process stop with the removal of clothing, jewelry, and covering affected area with cool water. So una po natin gagawin ay wag po nating hayaan na yung naging burn po natin ay parang nasa enclosed po ng nakatago sa damit o yung hindi po nahahanginan. Dapat pong basahin po agad to ng malamig na tubig po or yelo. Increase blood volume with IV inserted in intact skin area. Ito naman po sa hospital na po madalas ginagawa. Urinary catheter to monitor fluid output indicate dehydration pa. Para kita po natin kung dehydrated na po tayo. Intubation to secure an airway and to secure its vitals like blood pressure per minute and temperature po. Determine the extent of damage or the rules of 9 or land powder, which is ito po. Bodies, ito po yung rules of 9. So dito po natin i-present po yung ano po natin yung body surface affected po ng burn sa katawan, which is the rules of 9 po. Ang entire head po natin is nagaano po ng 9%, anterior torso which is 9% po uli. Each arm is 9%, so 18%. Abdomen, 9%. Upper back po is here, 9% again. Lower back is 9%. Front of each leg po is 9%. And the back of each leg, 18%. Ang groin po is nag-equal only to 1% na nagtototal po tayo sa 100%. This along with the cause of burns para po ma-determine po natin yung mga severity ng burn. Complication of major burns. Pulmonary injury or pag nagkaroon na po tayo ng stridor or yung whistling po while tayo habang nahinga, or sa Tagalog po yung sinasabi po natin na ano po, yung para pong may pusa sa bibig po pag nahinga, yung parang nasipol po. Yun po yung pag pulmonary burn injury po tayo. Hypovolemia is loss of plasma and decreased blood pressure. And hypothermia, which is with skin gone, there is no thermoregulation. Ito naman po yung pag nasunog po yung balat po natin, para po nag-aano na po yung natin. Cardiac arrhythmia or irregular heartbeat and kidney failure. Kailan po ba nagiging critical ang ating burn? Nagiging critical po ang ating burn pag yung pinakita ko po sa kanina, if the burn affected by the body scattered area is greater than 25% po. Or full or deep partial thickness burns greater than 10%. Pag yung pag sinabi pong any burn, kahit po yung third, second, or first degree, pag ito pong full, pag ito po yung sobrang lala po na sunog na greater than 10% po. Ito pong sa 25%, ito po yung parang yung kahit konting sunog lang po ng katawan, yung sugat-sugat. Pero pag nag-increase po siya ng 25, malala na po siya. Pero yung talaga naman pong sobrang lalang mga burn po, yung mga 30, kahit po 10% lang, na po siya, makaka-criteria na po natin siya as critical burn na po. Burns complicated by a respiratory or airway injury. Ito naman po yung madalas po ito isa pag nakaka-inhale po tayo ng smoke. Kaya po siya nagiging critical. Most burns involving the face, hands, feet, or genitals. Ito naman po yung pag sa kamay, sa paa, or sa ating pong genitals tayo na affected ng burn. Burns complicated by a fracture or major soft tissue injury. Or electrical or deep chemical burns. Ito po yung parang yung sunog po ay pasok po sa ating katawan na Pag yung talaga po ang baso po penetrating po yung paso. Classification of burns. There is the first degree or the superficial burns. It involves only the epidermis. Burn area is only red or no blisters, while second degree or partial thickness burns involve all of epidermis and varying depths of dermis. Ito naman po yung ang first degree po yung parang sunog lang po na napaso lang po ng konti. Ang second naman po yung parang pumasok po ng konti, parang yung nagkakaroon po tayo ng peklat na po tsaka po basa-basa. Its appearance is blisters, pink, moist, and extremely painful. Third degree or full thickness burns involve epidermis and the interdermis is possible. Burn types of thermal burns, most common other than sunburn. Ito naman po yung direct flame like from scalds and direct contact. Chemical, from contact po from strong acids or alkalis. Burning process continue as long as the chemical or agent is on the body. Need to know the specific chemical because the treatment must be specific. There is also the electrical, where is type 1, there is type 1, type 2, and type 3. Type 1 electrical burn or contact burn is the most common. Through electricity injury, burn is most severe at the entry and exit points. Type 2 is the flash burn, which victim becomes a part of an electrical arc. And type 3 is a flame burn, where electricity ignites the victim's clothing. Ang type 1 po, yung pinakasimple lang po, yung lang po, parang dumaloy lang po sa atin yung kuryente, which is lang po, parang ang pinakamasakit lang po niya is from point 1 to point 2 po. Kasi doon lang po dumaloy. Ang type 2 naman po, parang naging conductor na po yung katawan natin na parang nag-transfer pa po siya sa isa pang bagay. Ang type 1 po, parang ganun din po, kaso wala po siya ang pagtatransferan ng kuryente. Labas lang po sa katawan. Pag part 2 po, parang ito po yung dumadaloy. And the type 3 po, yung electricity naman po na sobrang lakas na nasunog na po yung na nag-i-indicate pag nasunog na po yung damit ng biktima pa. There's also the sunburn, which is radiation burns. These are by far the most common burns because of being exposed to enormous nuclear reactor, which is the sun. Sunburns are almost always superficial, but don't underestimate the potential severity of sunburn using the rule of nines. It is not uncommon for sunburn to reach critical stage, that is burns that is greater than 25% of the BSA. Some patients require skin grafting after prolonged exposure. Yun po yung sa sobrang tagal po nila para pong naprito na yung katawan po na kailangan na po ng skin grafting or transplant po ng skin. Jayus. Ang mag-report naman po ay si Jayus po.
Hello po. Since yung aming pong report ay about sa death related to PAR, ito naman po yung isa sa mga tragedy na nangyari noong March po 1996, yung Ozone Disco tragedy, na which is Ozone Disco was an immensely popular spot for students in the mid-90s. In March of 1996, it was the end of the school year and the bar was capitalizing on graduation season with the promo. On the night of March 18, 1996, Ozone Disco held an estimated 350 guests who wanted to celebrate the end of the chapter of their lives and start a new one. Nearly half of the crowd, 162 at least, however, had to enter short abruptly. The Ozone Disco tragedy is known as the worst fire in the Philippine history. Ito pong, so yun nga po sa sinabi sa article na to. Yung Ozone Disco po, parang yun po yung pinaka-popular nung mid-90s na nag-spark po yung sa may DJ side na electrical po. Tapos po sa sobrang dami po ng tao na which is yung 350 guests, para pong hindi ganaya nung place yung yung party. Kasabay po nung pag-spark nung sa electricals, para pong nag-stampede po hanggang sa namatay po yung 162. Next po. Next. The final death count was reported between 160 and 162 people, the latter being the figures cited by the trial court that heard the ensuing criminal case. So yun nga po, 162 people yung pong nabawian ng buhay with at least first to second degree burn. Tapos yung iba po karamihan sa namatay dahil po sa stampede at natrap po sila dun sa loob hanggang bumagsak yung ozone disco.
So fire safety in burns or injury statistics and incidence rate. Ang sa burn injury na po, and ito naman po yung statistics po na nagsasabi kung ano po yung madalas na ano po. The following statistics are the latest available po from the National Safe Kid Campaign and United States Fire Administration. The majority of fire-related deaths are caused by smoke inhalation of the toxic gases produced by fire. Actual flames and burns only account for about 30% of fire-related deaths and injury. Ito nga po yung sinasabi po natin na yung mga deaths po madalas ay hindi po due to actual flames po. More on ano po talaga, ang madami po ay inhalation of smoke po. The majority of fires that kills or injure children are residential fires. The majority of children ages 4 and younger who are hospitalized for burn-related injuries suffer from scald burns, 65%, or contact burns, which is 20%. And fire kills about 500 children ages 14 and under each year. Ito nga po yung marang nakikita po natin sa balita na madalas pong nagkokos ng sunog ay either ano po ng yung sa gadgets po natin na naiiwan or talaga pong mga batang napabayaan po na nalingat lang po yung bantay or magulang po. Kung ano-ano na po ang nadutdot na nagkokos po ng either parang electrical wire na fault wiring po or para pong naano po nila yung sa gasol po. Hot tap water scald burn causes more deaths and hospitalization than any other hot liquid burns. Causes. The leading cause of home fires and related injury is home cooking equipment. However, most fire-related deaths are from residential fire ignited by materials such as cigarettes. Ito nga po yung sinasabi po kanina na ang madalas po ay sa pagluluto po yung sa gas po na iiwang bukas. Pero po ang pinakamadalas po na ikinamamatay yung hit siya po ng sigarilyo na hindi po napatay ng ayos, na may hit, ano pa po siya, may konting spark pa po ng apoy na para pong lumilipat sa ano po ng kortina or nag-aano po ng sa content na nag-spark pa po ng apoy na nag-lead po sa ano po siya sa home fire po. The leading cause of residential fire-related deaths and injury among children and ages 9 and under is carelessness. Yun nga po yung sinabi ko po kanina. Yung nalingat lang po yung ano po, bantay or magulang. Nagkanda dut-dut na po ng dut-dut yung bata. The most common causes of product-related thermal burn injuries among children ages 14 and under are hair curlers, curling irons, room heaters, oven, ranges, irons, gasoline, and fireworks. Ito po yung mga products na madalas po pag naiwan po, katulad po yung pangkulot po ng buhok na minsan po pag nakasaksak po, kahit hindi na po tumutuloy po yung pag-init na nagkokos po ng parang electrical, yung ano po ng electrical wiring niya. Most scald burns to children, especially small children between the ages of 6 months and 2 years, are caused by hot foods or liquid spilled in the kitchen or other areas where food is prepared and served. Ito naman po yung mga ano lang po, yung common types of burns lang po na nangyayari sa bata po. Yung minsan napapaso po sa ang bibig kasi sobrang init ng pagkain or yung sabaw po natatapunan. And fire in the home. Home is the place people feel safest from fire, but it's actually the place they're at greatest risks. Approximately 80% of all US fire deaths occur in the home. An average of 7 people die in homes fire every day. Ito nga po yung sinasabi po natin na akala po natin porket nasa bahay po tayo, mahina po yung chance kasi sa bahay po tayo yung kasabihan po na ang bahay po ang pinaka-safe kasi po yung heart is where the home are. Pero according po sa statistics, ang bahay po ang pinaka-malaki ang at risk at fire. Kasi po, madalas po nandun po yung mga lutuan po natin na yun nga po yung pinakamataas na statistics na nagiging cause of fire. According to NFPA latest report, home fires and home fire deaths declined by about 50% since 1980s. However, the 7.8 deaths per 1,000 reported home fire reflects a 10% increase over the 7.1 rate in 1980. In other words, while the number of US home fires and home fire deaths has significantly declined over the past few decades, the death rate per 1,000 reported files is actually a little higher. This number shows that while we've made strong progress in preventing fires, mitigating their effects when they do happen remains a challenge. Today's home burn faster than ever. Experts say you may have a little as 2 minutes or even less to safely escape a typical home fire from the time the smoke alarm sounds. Ito nga po yung sinasabi po natin na dapat po lahat lagi pong ang bahay natin may ano po tayo, home plan na in case po na nagka-apoy, alam po natin kung saan tayo pupunta, saan tayo e-exit. Yun po isa in case po sa mga bahay na may 2 or 3 exits po. Pag 1 exit, syempre po doon lang po naman ang exit natin sa isang exit point po.
Sa ano nga po yung sinabi ko kanina, fire in the home, which is the most common po na pinanggagalingan ng fire. Ito naman po yung mga example na yun. The Werribee family home has been completely destroyed by the fire. The tragic deaths of 4 children in a house fire in Melbourne's West in early hours of Sunday morning has sparked an outpouring of grief as investigators piece together how the blaze began. Ito pong Werribee family home, which is yung the children who died were 2 boys aged 10 and 3 and 2 girls aged 6 and 1. Ito pong incident na ito ay naganap sa Melbourne, sa Australia po. Which is yun nga po, kala po natin, pinaka-safe po natin na place yung bahay. Pero ito rin po yung may greater risk kung saan pwede magmula ang sunog. Their parents, a man and woman, were taken to hospital along with their 8-year-old son all with smoke-related injuries. The man and the woman are in stable condition and the child has been discharged from hospital. Next po. Ari din po yung isa sa mga example kung nabalitaan niyo po yung nung nakaraan po. Doon po sa Santa Clara na nasunog. Ari po yung kuha sa aerial view ng nasunog na. Almost kalahati po ng ano. At aabot na rin po yun sa pier. Batangas City, more than 200 families were rendered homeless after a 5-hour fire hit a residential area Saturday in Sitio Ibaba, Barangay Santa Clara. An initial report from Batangas Police Provincial Office said the fire started in one of the residents and easily spread adjacent homes. Most of were made of light and combustible materials. Fire officials said more than 100 houses were either damaged or completely reduced to ashes. So far po, yung mga houses lang po yung nasira at wala naman pong casualties. Next po. Implications for preventions. Injuries have become an increasingly important contributor to global morbidity and mortality. In addition, fire injuries show the steepest social class gradient among childhood injuries because of their severity and their contribution to health inequalities. And because potential effective intervention exists, fire-related injuries should be targeted for prevention efforts. House fire caused the largest proportion of fire-related injuries. Two recent reviews did not identify evidence of a beneficial effect from community, school, or clinic-based fire safety education on fire injuries, although clinical counseling does appear to modestly improve smoke alarm ownership. Two non-randomized trials suggest that smoke alarm giveaway programs may be effective in reducing fire-related injuries, while legislation requiring smoke alarm or other fire protection measures is a potential solution implemented in many countries. Mm, ito naman po yung implication for prevention. Sabi nga po nila, ay, sabi nga po nila na yung
Nawala po ata si Jeyus. Ako na lang po magtuloy. Numerous other interventions to prevent fire-related injuries has been proposed. The potential benefits of smoking prevention and cessation programs, given that smokers' materials were the sources of ignition in 18% of fires. 6% of injuries resulted from clothing or nightwear catching fire, suggesting that flames retardant clothing may be a beneficial intervention. A large proportion of our populations live in older homes which may be substandard electrical wiring. Ito nga po yung sinasabi po natin na mas nakakasunog, mas madali pong matumpok ng sunog yung mga lumang bahay po na naka ano po sa atin. Kasi po yung mga lumang bahay po parang mas ano po sila na there are built from woods lang po. Napakadaming part ng bahay po ng ila. Parang kahit po kisame, kahit dingding, ano po, kahoy lang po. Hindi po tulad ngayon na mostly bakal na po ang ginagamit natin. Mas ano na ba? Appliances and heating device and 8% of injuries were due to electrical failures. Efforts to address electrical systems and appliances with building codes, regulations, financial incentives for replacements. Ito naman po yung parang ang balak po nila pag may nakita na po na parang electrical nasira po na appliance sa appliance po natin or sa bahay po natin, ang ginagawa po nila ay parang binibigyan po nila ng incentives po pag ini-report or parang pag pinapalitan po. Other efforts to reduce substandard housing may be used in similar population. Other promising environmental modification includes self-extinguished cigarettes, non-flammable furnishings and building materials, and the wider use of sprinkler system. Sa atin naman po, hindi po common sa atin yung sprinkler system. Tapos, yung self-extinguishing cigarettes po, parang hindi pa rin naman po masyadong common sa atin. Pero po yung non-flammable furnishing po, para pong mas nagiging common na po sa atin, para pong as time progress po.
hello po. Wala po kanina.
Pare.
Doon naman po sa sinabi ni Neil kanina sa before po ito. Yung mga sprinkler systems, yung pong mga sa cigarettes po na naiwang naka-ignite pa. Yun naman po ay nape-prevent through fire literacy na dapat po natin pinapractice para po ma-prevent natin ng such fire na incident. In our study, 10% of injuries were intentional. Measures designed to prevent unintentional fires are less likely to prevent such injuries. Clinical and community interventions to address domestic violence and substance abuse, and to promote the adequate monitoring and treatment of patients with mental illness may be valued. Because of direct causes of fire and flame injuries, it is likely that diverse interventions targeted to those at highest risk, that is, the elderly, families with young children, and poor, may be required to address this important public health problem.
Ito naman po yung mga example po ng burns na sinasabi ko sa inyo. Isasend ko na lang din po sa GC po yung mga link po ng pictures na to po. Ito po yung soot in trachea, indication of inhalation of smoke po. Ito naman po yung pag sa murder. The hand and hand were removed before the rest of the body was burned in an automobile. Siguro po dito po is a case of parang itinatago po yung ebidensya. This heat ruptured the skin, resembles an incised wound. Ito naman po yung wound na parang natuklap na po talaga yung outer layer ng balat natin na parang nag-resemble po siya sa isang incised wound. And ito naman po yung common na electrocution, an electric mark revealing the shape of the conductor. Parang nag-produce po talaga ng heat yung bakal po due to electricity na which na nag-cause po ng burn. Ito naman po yung burn na talaga pong na third degree po na pasok po na parang chemical burn po siya. Typical chemical burn. Na which nga po, kailangan po natin malaman kung ano yung chemical. Baka po may specific treatment na kailangan para sa anong pong yun, sa treatment. And this naman po yung lightning stroke, since lightning stroke po na na burn, na nagli-leave po ng abortion marking sa skin po natin na parang yung para pong sa snowflake po, ng parang snowflake effect po or yung ugat po na nabakat sa atin pong parang nakakaugat po ng roots of trees po na nalabas po sa natin. And thank you po sa pakikinig po ng report namin. So ito po yung po, if anything can go wrong or fail, it will go wrong or fail in due time. Ito po yung para pong pag meron pong maaaring mangyaring mali, ito po yung Murphy's Law na tinatawag na if kung may mangyayari talaga masama, mangyayari po 'yan. Kaya talaga kailangan pa natin todo ingat. Salamat po.